the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Motion to adopt the agenda. Moved by Myjak, supported by Romano. Please vote. Motion passes. Okay. Approval of the minutes dated October 9th, 2019. October 9th?
Yes.
Wow. Okay. Wow. You're welcome. Moved by Carabelli, support by Kraft. Please vote. I didn't catch that. Motion passes. Public participation. Does anyone wish to be heard? Anyone wish to be heard? Seeing none, we'll close public participation. Budget reviews, health and community services. Who am I calling up?
I don't know, maybe JP.
Okay, JP, you're up. And wait, before you start, let me go ahead and get the motion to receive and file. Moved by Kraft, supported by Drollet. Go ahead, thank you.
Thank you, Commissioner. Appreciate the opportunity to be here today on behalf of the Health and Community Services Division. More or less today, what we have are chief administrators from each one of the divisions that are going to provide you an overview, not only with the information that's in your packet, but also give you a little bit more deeper dive into some of the core programs and services that we're looking to champion across the divisions. The biggest thing as far as priorities go from a budgetary perspective, as we've been working not only with each one of the financial experts in each one of the divisions, is not only stabilizing those core programs which have had the greatest evidence-based return on investment as far as what we provide, but most importantly, understanding how we can find those efficiencies in some of those core program areas where we have service more or less correlations. One of those key ones with now new leadership in the Office of Senior Services is understand how we're developing more dynamic programming for the elderly population across the county, and also looking at some creative elements with regards to early childhood development. So with that, I'm going to yield my time to Chief of Staff of the Health and Community Services Divisions, Dr. Hollowell.
Good afternoon, Commissioners. I am Dr. Alicia Hollowell, Chief of Staff for the Macomb County Department of Health and Community Services. In the absence of a director, I will be presenting for the Department of Health and Community Services. In 2020, we plan to continue to enhance the ability of the county's health and community services agencies to promote well-being and assure the basic human needs of county residents are met. One of our biggest accomplishments for 2020 was securing funding to establish a municipal complete count committee to be able to get out information about the upcoming census so that everyone in Macomb County is counted. Our goal is to continue to enhance cross-departmental coordination, health equity, and social mobility. We have reviewed the budget, and we are supportive of the executive's recommendation for health and community services budget.
Okay, I don't have any speakers on here.
Oh, his isn't working either, I'm sorry.
Oh, okay. I can do it by hand if I have to. We'll start with Commissioner Carabelli.
Thank you, Madam Chair. Thank you, Doctor. I don't know if this is for you or for Steve, but the first question I have is licenses and permits. It's about a $900,000 swing, and I don't know if that's a typo or what the heck is going on. Oh, wrong one. I apologize. Wrong sheet. That's the next one.
My God.
That's the next one.
It's not us.
I yield my time.
Sorry about that.
It's okay.
Commissioner Drollet.
Thank you, Madam Chair. Drolet. And thank you, Doctor, for your presentation. JP mentioned the increased efficiencies of coordinating the various departments. Have we achieved increased efficiencies? And if we have, has that reduced the budget because we're more efficient, or is the budget going up?
Currently, we are examining where we are in terms of deficiencies and efficiencies so that we can make the correct decisions moving forward.
So no efficiencies have been achieved yet, but we hope that they will.
Yes.
How long has this department been in existence?
May I?
Please, JP.
Yeah, so, thank you for your inquiry on that end. I think the most interesting thing that we've been looking at specifically on the Health and Community Service side is not only the way in which we're deploying these projects, but how we're looking at an entire continuum of care. One of the things that we're looking at right now is a whole case management perspective, which Dr. Hollowell and our folks at MCI are looking at. So when an individual engages our services, whether it be on the senior side, whether it be on the food security side, whether it be on the early childhood development side, it's how are we ensuring the handoffs, whether they start off in our MCA division, whether they start off in our health department, or they come in through the great services provided by Michigan State University Extension. That's been one of the core things that we've been looking at over the past 3 months and understanding how we optimize that and also what that means from a grant compliance perspective, and then how we can also make ourselves more competitive for additional grants coming down the pipeline. We've gotten a tremendous amount of insight and support from the Michigan Community Action Agency to understand how we better leverage the pool of money that comes in from our folks at the state level, and then we're also scaling up some efficiencies to understand how we can be more competitive from the federal side on some of those grants.
Okay, thank you, JP. Do you think, please stay there. I don't know which one of you might be best to answer this question, but given that role, would it potentially be more cost-effective to move this department directly under the health department budget and have the doctor work on those particular projects under there and then not replace the director? Since the director is essentially directing one person, I know there's other departments underneath there that they're managing, but could we save money just by moving the person doing the work, the doctor here, into the health department and not replace the director and have her do exactly what she's doing now?
I very much appreciate your inquiry on that side, and undoubtedly that could be an option that could be assessed and discussed. I will tell you right now, from a coordination perspective, from a management perspective, as we look at the HNCS vacancy right now, I think that that is a position in which we can bring in an administrator that would have the ability to not only optimize the resources that are coming in, but also help us restore and enforce some of those operational efficiencies that we hope to have across all these programs moving forward. The other thing that we're very much looking at too is the arenas in which we provide these services. I think with our family resource centers and the way that we've established those, we've had a tremendous amount of opportunity for resource sharing, whether it's with the expansion of the Nurse Family Partnership Program, the WIC programs, where we're now partnering with local school districts and saving ourselves monies on facilities. These are things that we've only pretty much been doing in a beta test phase right now, which very much will be a part of that solution-based proponent as far as high-ranking administrators across these divisions.
Okay, well, I don't know what you just said, but I think...
That was a long administrative way of saying we're doing some really good things.
Great, and
Yeah.
I would...
Put it in first grade.
I would ask that perhaps some thought be given to doing those incredibly great things with the incredibly great person that we have
I would concur.
in an existing department and eliminating the need for her to have a director, let her be working under one of our very capable directors in another department, and save us some money and continue to do the great work.
Commissioner Drollet, the other thing is a decision of that magnitude would have some charter ramifications that we would have to analyze too.
Is this a charter required
It is
position?
a charter mandated department.
Okay, I did not know that. It helps answer the question. Yeah, so it's a charter mandated department.
Health and Community Services is, correct, sir.
Great. Health department is too, I assume?
Yes. Yeah, it created under Public Health Code. So we have to have one of those, state enabling legislation.
Gotcha. Okay, thank you very much. Thank you,
Appreciate it.
Madam Chair.
Point of
Yep.
information, it is in the charter that we have required to have that department. It doesn't require the staffing levels or the titles we give those people operating in that department. So there is flexibility within there to give us, to do what we knew was best.
So just, if I may, respond to that, we could have that department, but place the personnel under the health department and just have one personnel.
Where there's a will, there's a way.
Gotcha.
Thank you.
Thank you, Madam Chair.
Right, or vice versa. I'll bring that up when it's my turn to speak. Commissioner Duje?
Thank you very much, Madam Chair. There's nothing on here as far as revenues, and a lot of this is grants, I imagine, and if not all of it. Where are those listed?
Historically, this department has been 100% funded by the capital fund. General fund, sorry.
General fund, okay. So, but you guys, the department itself has gone in for grants since day one, if I'm not mistaken.
Correct.
And a lot of the money that is taken to run it, we get our percentage for administration, but the programs that are run through this department are mostly grant funded. I found it very interesting as far as the interaction between this department and AAA 1B. How dependent is a lot of the things that this department does on AAA 1B?
So MCA will be up shortly to the podium, and they will be able to provide more insight into how our new OSS director, Ms. Cote, is working with AAA-1B.
Okay. I can see why somebody would want to mix this in with the health department and everything, but it might be a better idea to leave it separate because they are doing things that, although peripherally are related to the health department, it's unique as far as they're worried. They're worried a lot about the living. Let's put it that way. I hope that everything works well in this department. I look forward to the future of it.
Thank you.
Thank you, Madam Chair.
Okay, so I'm going to piggyback on, and by the way, under new business, we're going to settle the name thing once and for all, because he told me he goes by Gillette. So we'll adjourn after we get that settled. But anyway, I'm going to piggyback on what Commissioner D was talking about. The last year, we changed a position in that department and gave a $25,000 job reclassification and increase to the position. And Director Smeagol has indicated to us that we may be going into some tough times. We might be okay in 2020, but there's some concern about 21 and 22. So our thought process is, we're kind of thinking and talking about, instead of just doing for us to do a slash and burn on areas that we don't necessarily know. We don't want to cut you guys off at the knees in really important areas, but we want to achieve trying to spend less than we bring in because every year we have not done that during the good times. And so I look at this one and I say, there is a vacancy. So there's an opportunity to look at the departments that report to this department. And he's saying move it under health, but health technically reports to them. I wouldn't even care how you look at reclassifying things, but there's an opportunity to do so, and that's all I was suggesting is, I'm suggesting is maybe just keeping it vacant long enough to take a look at that and see if it's doable, because that could be an area where we don't have to hurt anybody and make some strides in cutting some money out of the budget.
I very much welcome the comment, and I can assure you that from an organizational standpoint, we are assessing the implications not only from a budgetary perspective, but also from a reporting perspective.
Okay, thank you. Commissioner Romano.
I understood that part, JP. We have Dr. Hollowell here, and it's Chief of Staff, but we talked about my favorite subject, which is grants.
Yeah.
So you have your budget now. None of this is including any grants. So my question is, I'm sure you're going to be applying for grants while this budget is in effect. And if those grants come in, are you going to turn that money back into us that we allotted to you?
Yes, so each one of the divisions that are here are going to step up to the podium next. Will give a little bit more insight into different grants and special initiatives that are kind of evolving within this next fiscal year, not only from the standpoint of some senior programming, also some visiting nurse programs too, which are evolving in the county that will bring in additional revenues to offset expenditures for the county.
So that answer is?
Yes.
You will be refunding back to us once those grants are achieved?
There's always administrative dollars that comes back to the county on that side. And we're also open to conversations with regards to indirect costs that have an implication with regards to day-to-day admin too, that is openly being discussed with finance and the divisions too.
Isn't he good, Dr. Hollowell?
Pardon
Isn't
me?
he good? I said, isn't he good? He's great, isn't he?
Absolutely, he is good.
Thank you. That's all I have, Chair.
Thank you.
Thank you. I don't see any other speakers. Please vote. Motion passes 9-0. Next, we'll do the Health Department. And we have Mr. Riddella, Director and Health Officer. Titles change all the time. Hi, Bill.
Good afternoon. Okay. Been a busy day with some of the things going out in the community with Legionella disease. So, general fund. Our general fund for 2020 is very similar to our budget that's currently for 2019 and the amended budget that we have in 2019. So our request for general fund support, which is outlined on page C36 of the budget book, is a little over $22,196,000. This is a 1.3% increase above the current amended budget of 2019, or about $292,000. Now, the bulk of this increase is due to increases in personnel expenditures. We've had an increase of about 4.9%, or $663,000 in our personnel costs, and a lot of this has been driven by the salary adjustments from the class and compensation adjustments that were made and will be also applied in 2020, as well as the normal incremental salary adjustments that occur with staff, since we have a lot of staff that are still moving through their incremental changes within the department. Collectively, our other expenses, excluding the personnel, are actually decreasing by about $370,000 collectively, or 4.4%. And mainly, a lot of this is due to a reduction in our county cost allocation expense. So changes have been made, and our total expenses, besides the personnel, are going down. On the revenue side, our revenues on the general fund side are budgeted at almost $8 million, which is about almost an $80,000 or 1% increase in revenues, and these are primarily from changes that we are projecting in our charges and billings for our clinical services, especially things we do like immunizations, TB testing, our family planning program. Those are some of the billable services that are in the department that we have about an $80,000 increase. And for the most part, a lot of our revenues that we do budgets primarily on the conservative side. We don't want to overestimate in a budget what we're putting in there, and a lot of times, as you'll see, there is some variation, but we have been, for the most part, meeting the revenue projections over the years within the department on the general fund side. Now, on the position changes, we've made no changes on the general fund side in any positions. There's no change on the general fund side. We're keeping the same positions within the general fund, and the majority of our positions are filled within the department. The one area that we're looking to make some changes is in our grants. We've had a increase in our WIC grant. Our allocation for our WIC program has been increased by the state. Letters came over the summer. That's been included in this budget. With that, we are looking to add some positions that we need. One of those is a public health nutritionist in the program. This position is an individual that provides the nutrition counseling, the nutrition education, and the enrollment of clients into the program. So again, looking to increase enrollment in the program, and again, a public health nutritionist is needed. County position, these grant dollars can support that. The other position is a lactation specialist. The demand and need for working within the WIC program with the moms for increasing consultation and education for breastfeeding, which is, yes, going up in Macomb County. The numbers are going up. And having a lactation specialist in place, which is a position we have. It's not a new position. This will be a new position, but we have one right now, but this will help us work within the community too, besides just the program, and working with the hospitals, because the hospitals, especially in the delivery areas, of working with new moms and increasing breastfeeding within the county. So those are, again, grant-funded positions for 2 within WIC. The other change is in our Children's Special Health Care Service program. Same dollars from our grant. What we're planning to do there is need-based. We have plans to reduce 1 senior office assistant position. So it's a vacant position. We don't plan to fill that. Again, on the grant side, and half-time, part-time nurse. So we want to eliminate 1.5 staff in that program and create 1 public health nurse position full-time to provide the case management services and care coordination services needed to families that have children with special needs. It's an area where we are not providing all the service we can in that area, and we are continuing to see an increase in families needing this program, because this is, again, we probably have 2,500 families enrolled in this program, and they all have kids with special needs. And navigating the healthcare system, the insurance system, is what our public health nurses help them and case manage these, along with the Medicaid health plans that many of them are on. So that basically is a little bit of a cost savings, about $10,000 within the grants that we can apply for other things within that program. So overall, we are satisfied with the recommended budget that's presented here in front of you for the general fund. We believe these funds will help us as a health department maintain our state accreditation. We are expecting our 3-year review in April of 2020. In 10 of our programs, and also administration has a review. So that'll occur in April, and we've been achieving that since the year 2000. We also are looking to hopefully in 2020 have a national review for national accreditation. We are seeking national accreditation as a local health department. We have to get all of our documents in mid-November. So crunch time is among us to send all our documentation in, and we hope to expect a visit by the State Accreditation Board sometime in 2020. Again, don't know a timing on that because they are busy with a lot of these visits across the country. We will continue to work on our community health assessment. We have to do another community health assessment with our partners in 2020, and that'll help us with our community health improvement plan. All these documents are on our website. We share them with the public, and you're welcome to review those on our website. We do plan to expand our nurse-family partnership program. This is the first program which I brought to the attention of the board a year or 2 ago that we implemented in our Thompson, in our South Warren area. And we will be, we've heard from the state that we are going to get additional grant dollars. And the national office is excited to hear that we're going to expand this program in Macomb County for first-time moms. So hopefully the funds will support 2 public health nurses in our Nurse-Family Partnership Program, and when we receive those grant dollars, we will bring those to your attention and approval. We look forward to implementing a lot of the technology changes we've already launched in our environmental health programs to better automate our entire program, from our food inspections to our on-site sewage inspections and to our well program, so that we are much more automated and are using technology for efficiencies in that program. And we look forward to the implementation of Acela, which is the product that we are working with. And overall, again, we look to continue the quality improvement work we do in all of our essential services to deliver quality services and immunizations, maternal and child health home visits, our STD and HIV testing and counseling programs, our communicable disease work that we do, and that area has been extremely busy the last few days, and will continue to be busy working on some of the things going on in Macomb County related to communicable disease, and all of our environmental health programs, from food, water, septic. With that, I will ask if there are any questions about any of the budget information presented before you.
Thank you. Commissioner Brown?
Thank you. I appreciate the good work on your budget, and the expenditure categories. You know, almost more than half of them have been reduced as opposed to increasing every year. And I mean, personnel costs drove up your budget basically, but you did a good job of keeping expenses flat, in fact, a little bit less in most 5 of those categories anyway. And I appreciate that. And you guys do good work. You're relied upon a lot by us commissioners for the variety of things we come across in our district. And you've got good staff, and they answer the call when asked. I've got a question about the hepatitis outbreak that we experienced earlier in the year. Where are we at with that? Has that been stabilized? Is that where? Can you give me a summary of what's happening there?
So statewide, this began in August of 2016, and we had well over 200 cases. I think we ended up with 225 cases within the first 2 years. As of December, actually this year, I don't believe we've had many cases. This has really come to, I don't want to ever say it's going to end on, because we always get hepatitis A cases, but the outbreak in Michigan has reduced quite a bit. We're still having conference calls with the state, but what we're on guard for is we know Ohio and Indiana, our border states, are still having outbreaks. And some of the states even below them, Kentucky, Tennessee, West Virginia, are still having outbreaks. So this is still a national problem, Commissioners. In Michigan, though, we've seen a significant reduction. We did a lot of immunizations. Our partners did, our healthcare partners. So again, we are keeping our guard up, but a lot of the immunization efforts, we still continue those at in the jail. We still continue those at some of our inpatient substance use disorder treatment facilities. So we will continue those efforts because those are some of the high-risk populations.
Thank you. Thank you, Madam Chairwoman.
Thank you. I just have a couple of questions very quickly. On the budget, with respect to conferences and training, in 2014, it went up 10,000, and then in 2017, it went up 26,000, and then in 2019, it went up 18,000. And then there was an amendment for another 3 more. So you did drop it down to 74, but historically, I mean, it went from 36,000 and we're at 74. Yeah, I know it's the difference between those two. But this is what we adopted last year at the beginning of the year. And then he went up, we did an amendment for 3. So I'm saying this is what we originally adopted. So from the original adoption, that's correct, we amended it. But every time we amend, if it's for a specific purpose, the following year, that shouldn't be considered the baseline, is why I'm coming from that perspective. I mean, obviously, we amended it for a reason. So, number one, do you have out-of-state travel that you do?
We do have some, yes, that is correct.
Okay, could you get us a list of the, I don't need a list of all the training, but just the general conferences that you go to?
Yeah, in fact, last year we submitted a list, which is, I'll be honest with you, it's that list you have from last year is pretty similar. There's probably been a little bit of reduction because of the reduction in the budget, but many of those conferences at a national level, we are expected to be at some of these at the national level. We're a staff of 250 people. Workforce development is critical in our department. It's an essential responsibility of accreditation work we do, and also for staff training.
And I'm not opposed to traveling nationally. I don't want you to get me wrong, because I do think it's important to hear what other states are doing. Also, one of the things I'm curious about is the number of people that travel to different conferences. You know, are there 20 traveling to the same conference as opposed to 5 or that sort of thing? But I just because I asked the question, I don't want you to think that I think it's inappropriate, because I don't think it's inappropriate.
Yes, I understand that. Thank
Okay.
you.
And I'm not even looking necessarily to do anything this year. I'm sort of preparing myself in case we have big problems in the future. What can we do? What are the things that we can do to help us out of it? And then in repairs and maintenance, in 16 it was 35, and then it went up to 16 and 18, and then sorry, I lost my line here. Okay, it was in 2019 it was 30, and it went up to 41. Right, so I just wanted to point out, so that the amended is a drop, but it's going back down to the original. So I'm assuming that we amended it for a specific purpose, and it's going back down to where it probably should be.
Okay.
Does that make sense to you?
Yeah.
Okay.
Again, and I think I would ask Patrick, if you have any comment on that?
I can't think of the event right now, but it's easy enough.
But there's probably something?
Yeah.
Okay. All right. And then the last one is contract services.
The supplementals we got late this afternoon, so that. it
Oh,
has its
okay.
conferences and training, but I just got
Okay,
it.
I apologize. I didn't see this before. Thank you for that. Okay, so contract services then, also, it was at 790 in 2015 actual, and then it went up to 997, and now it was amended in 19 to go from 997 to 1.15 million. Now, in the recommended, we're at 1.235 million. So that's a pretty significant jump in 2 years. Do you know why we're having that kind of a jump?
A couple of things. One, and just so everybody knows, again, we've got dollars spread across a lot of our programs and contractual services. Almost 60% of those funds are in the medical examiner's office. The contract, of course, for our pathologist work, and then all of the laboratory. Those are pretty much been stable. We've increased over the last couple of years the contractual dollars for our outside pathologists that support Dr. Spitz and Dr. Pietrangelo. We increased that last year, $50,000. We're increasing that by $15,000 this year. A second thing we have done too is some of our grant dollars coming in, we direct those to the county side to actually bring aboard some people contractually as opposed to creating county positions. We added the public health compliance specialist in 19, and we brought that person aboard. They are contractual with our fiduciary, so they are an employee of the fiduciary, but they are doing all of our compliance work related to HIPAA, ADA compliance, and some other areas too that we are expected to do. So that person actually was brought aboard. We've actually brought a couple of other positions through grant dollars directed to the county for contractual staff as opposed to bringing on full-time county employees. We've also, again, within those dollars too, we have funding supporting our opioid coalition, Operation RX, in the vicinity of about 20 or 25,000, I don't remember the exact amount. And again, it's just this redirection, Commissioner, of some of our grant dollars to contractual as opposed to putting them into personnel.
When you say a redirection of the grant dollars to contractual, so if the grants run out, does that mean that the positions cease to exist then?
It happens in all of our grant programs. If we lose grant dollars in any area, and this has happened in the past, and even though that position is a county position, there could be staff reductions.
And the positions you stated in the medical examiner's office we're getting grant money for that?
No, not in the medical.
Not on
exam.
those?
No, those
Okay,
are general fund dollars.
so those are increases in positions that we didn't increase the number of employees we did through contractual services, I'm assuming based on a need for more employees in that department.
Yes, and again, the employees are the forensic pathologists that we need to support the additional work in that area, in that office. And Dr. Spitz will be up later and can comment on that.
Okay. Okay, then, that's all I have for now. Commissioner Romano.
Thank you, Madam Chair. Hi, Bill.
Hi, Commissioner.
Bill, I'm going to talk about this WIC grant. It's a specific grant. Is it for a specific reason, or do they give you this grant and say, do with it as you please within the confines of what you do?
The WIC program is a United States Department of Agriculture program. It's called the Special Supplemental Program for Women, Infants, and Children. Pregnant women, infants, and children under the age 5 are receiving food. They used to get food vouchers. Now they get a card with specific foods that they can provide during pregnancy, infancy, and early childhood. And they also are provided with nutrition education, nutrition counseling during pregnancy, breastfeeding, and a lot of referrals to other services that they are eligible for. We do immunizations in our WIC program, lead testing in our WIC program. So there are a lot of requirements. It's a federal program. Money goes through the state. Started in 1972, as a federal program. It's one of the largest, besides the SNAP program, it's one of the largest USDA food programs in the country.
Who determines where the money actually goes? You mentioned here, for example, you mentioned here a nutritionist and you mentioned a lactation program. Incidentally, let me just back up a little bit. Lactation program. I take it this is for the newborn. Don't they get that information at the hospitals when they have those kids? I'm just asking because I don't know. Same thing like the nutritionist. Isn't there a nutritionist on staff now?
Within our program?
Yes.
Yes, and we, as we've grown this program, we have, in working with our state who does management evaluations of our program, that's an area of doing nutrition counseling that they've seen a need for us to do, to increase that within our program, and has made that as a recommendation.
So we have one, we're just adding another one.
Yes.
How about the lactation program?
We have one with, I believe we have one in the county now, Krista? Yes, we have one right now, and this is, again, a need is there. The program identifies a need for this. They work with the state very closely. The state has to approve our budgets as they have given us this additional allocation. But a lot of that flexibility is here locally. They're not going to dictate that we add this or that, but we have looked at the best need for our services. I listen to my staff. I don't give them everything, but collectively we have come up with a decision that these are the two positions that we need as priority within this program.
How much money is in the WIC grant?
Probably 2.3 million, 2 million.
I mean, just an approximate, that's all.
Yeah, it's about that 2 to 2.2 million.
Well, we'll use 2 million as
And the bulk of it is salaries and fringe benefits for our staff.
So for these two people we're talking about?
No, that's for the entire staff in the program.
How many is in the staff in the WIC grant?
Let's see.
So are we saying that you're hiring more than just a nutritionist and a lactation program?
Just for, I mean, right now, there's how many, Patrick? There's 25 employees. There's 25 employees just in our WIC program, full and part, some are full-time, some are part-time? Yeah.
And this $2 million, approximately $2 million, is in personnel costs? Is that where you're
I would
at?
say probably a good 80% is.
80% of it is?
Do you agree?
Yeah, it's somewhere.
Probably 80% of our costs in the WIC program are salaries and fringe benefits.
And you've identified the fact that we need another nutritionist. I like the idea that it's a grant. I mean, that's why I never give you a big deal about it. I like grants. But I guess the same question I'd have is what the chair has is, I'm concerned that once these grants run out, all of a sudden now we're going to say, hey, do we need another nutritionist because we've had one? Do we need another lactation program because we have only one and now we've lost that? And that would be my concern. So I understand where you're coming from. I'm just, like you said, our director of finance said 21, 22, or 22 is going to be tough times. I'd hate to have Bill come before me and say, hey, we need these people and we ran out of grant money. Just a statement. Don't need to comment on it. That's all I have. Thanks, Chair.
Thank you. Commissioner Doucet.
Thank you, Madam Chair. Hi, Bill. Are we having fun yet?
Always.
Every day. A couple of questions. Nutritionists, do you work at all with the people from Martha T? Do you touch bases with them? Is it possible to work with them on some of this nutritionist? I doubt lactating specialists, but nutritionists anyway, from Martha T.
In the area of food service that they have at Martha T, we've provided some consultation on their operations from a food sanitation perspective, the building of their kitchen, consultation on that. As far as services towards pregnant women, infants, and children, when they're dealing with the long-term care facility, we haven't worked with them in that area.
Well, I'd be thinking nutritionists as far as senior programs, as far as the AAA 1B, and I'm not picking on them. But if there was a way to utilize a nutritionist at Martha T for some of the things that you do at the health department, save yourself some money, possibly.
Well, we can talk to Kevin and see what opportunities there are.
The other one was the health needs. You said that some of the kids and so on have problems. Have you worked with CMH or approached CMH on some of these problems, or does CMH refer them to you?
We do work with community mental health, with the Macomb Intermediate School District very closely during our work together with families that have special needs. So yes, there is collaboration with mental health, definitely.
Okay. The Majestic Center and the Thompson Center are both in Warren. The Majestic Center is losing the state people. Are you planning on filling the areas that the state is vacating with more of your people, or how is that going to work? Or haven't you gotten that far yet?
Again, we've been informed that the Department of Human Services is looking to relocate in Warren. When that will occur, we've had projections of sometime either late 2020 or into 2021. How that space will be used is something that we still will be talking with Health and Community Services.
Okay,
and
so
with
that's
others
still
about
up in the
that.
air.
Correct.
Go ahead,
JP's
JP.
behind
On
you.
that one, too. Yeah, the space utilization and the impact of the state's intent of not only phasing out of the Majestic Center, but also at the VERC is something that we are currently analyzing. As Bill highlighted, the state has not given us a direct date yet when they will vacate that. The other thing that we will also be assessing in this is how it works into the capital program with some of the aspirations that we've programmed into the budget heading into 2021 that would not only analyze the relocation of the health department over to the VERC, and then the implication as far as program service delivery from that facility too, and then how that also dovetails into the medical examiners and some of the expansion facilities that we're looking at.
I mean, there's going to be a whole bunch of moving around.
Yes.
And I don't know how the state, I mean, in their flashy way, taking care of things quickly. You think they'll figure out what they're doing by 2021?
Great question, thank you for asking. As many of you will see on Gratiot, just south of N59 on the west side of Gratiot, the state is developing the new facility there. We do not have a phase-in strategy. We also are discussing with the state how the service provision will work there in their new facility, and we're very much not only analyzing that from a service provision, but as we've discussed with Director Schmiegel, what will that look like as far as the resources that we bring in from the state?
Okay, so that's still all up in the air.
Very much so.
All right. The Thompson Center, I'm very, very happy with what's going on there. Hopefully, you're keeping everything status quo, if not trying to expand a little bit services as far as nutrition, lactating specialists, and so on and so forth. What's the future bringing at the Thompson Center as far as the health department's concerned?
Well, we have 3 services down there. We have our WIC program.
Right.
That's one of the locations, and we do move our staff to different locations, so they're there 4 days a week. We have our nurse-family partnership program operating out of that location, and also family planning is there once a week, our family planning program. Other partners in there, of course, are Macomb Community Action, MSU Extension, and the Children's Healthcare Access Program, which is going through some transition right now, and will be looking to reoccupy some of the space in that building. So,
even better.
there's a lot going on there right now.
All right. Last but not least, there have been a number of questions that are brought up at the board level about grants and grant-funded positions. And out of all the departments that I know of, Health Department has never had a problem that once the grant runs out, the people are caught, basically, because there's no way to pay them. Are you planning on keeping this going in the future?
I believe so, sir. I don't think we have much of a choice when it comes to our grant programs. Unless there's additional revenue we find somewhere else. But again, the whole idea is we do expect, as I said, we heard from the state that we're going to get some additional dollars to expand our nurse-family partnership program.
Right.
Sustainability of that looks good, but should there be changes, we would have to make some changes.
All right.
That has to happen.
Very good. Keep up the good work. Thank you, Madam Chair.
Thank you. The commissioners whose last name spelled backwards is Taylor.
Thank you, Madam Chair, I think. Just a quick note on the grant funding and the ending of the grant issues. I mean, it seems to me the only alternative to avoid the kind of concerns commissioners have is to no longer accept grants. That way we don't have to worry about them ending. I mean, it's an inherent problem, it's an inherent circumstance of grants. I mean, it would make no sense not to accept the grant because someday it might end. I mean, it's just a reality, the circumstance. So I'm only looking at your budget from the general fund perspective. And I know it's a complicated budget with a lot of grants and a lot of state funding, but from just a general fund perspective, looking at the numbers from like last year to the projected this year budget, I'm extremely concerned that I can't get upset because it's such a modest increase. And I'd like to extend my personal appreciation to your work in keeping the increases as low as possible to the general fund and the work of finance and the people within your department. So whether that's through, luck or grant work or whatever it might be, it's been a very modest increase, and I, from just a budgeting perspective, appreciate that. And thank you for your work.
Thank you, sir.
Thank you, Madam Chair.
Thank you, Commissioner Sauger.
Yeah, Bill, maybe you can answer this, or maybe Steve. I'm just curious. On the page 39, C39 in the budget book, under contract services, the last couple of years, it was down 3,000, then it jumped up to 69,000, 66, and then it's going to go back down to 4,000. What caused that jump or that decline?
Again, that's under Health and Community Services, Commissioner, but I believe there was dollars put in there for some compliance work.
Accreditation and
Accreditation.
HIPAA compliance.
Huh?
Accreditation and HIPAA compliance.
Okay. All right,
And
thanks.
that was more county-wide than just the health department. So I think that was some
Thank you.
money that was added in for a one-year process.
Okay, I don't see any other commissioners. I didn't get a receive and file, did I, for you? I'm sorry about that, Mike. Moved by Carabelli, supported by Duge. Please vote. Motion passes 9-0. Next, we have Macomb Community Action. Oh, I'm sorry. Just a second. Okay, so we were going to have the medical examiner's office come up, even though it's not technically on here because it falls underneath the health department. Sorry about that. Dr. Spitz.
Good afternoon. The medical examiner's budget really is the status quo from 2019 for going forward. Excuse me. Really, our operating expenses are largely unchanged. Our contractual services increased slightly, and that was really related to some automatic increases that are year to year, as well as an increase in an area that deals with some locum tenens type work for outside forensic pathologists to come in and do some cases at the medical examiner's office. Our revenue, and that's really to keep our autopsy numbers at a level that allows us to continue to be accredited by the National Association of Medical Examiners. And that's something we've been doing for the last several years. Our revenue is also largely unchanged. In terms of some of the things that have been going on in the medical examiner's office, we did have a site visit. Most of you know that the office is accredited, or all of you should know that we're accredited by the National Association of Medical Examiners, and that originally occurred back in 2014. And the way it works is once you become accredited after a site visit, then you do online applications every year that then are evaluated online, and that goes for 5 years. And so we were at the 5-year mark, so we had our 5-year site visit, and that occurred on August 14th 2019. We had a gentleman named Dr. Marcus Nishalski. He came from Iowa, where he is a chief medical examiner, and he spent a full day at the office, and that was after he spent quite a lot of time reviewing all of our areas online. So then he came to the office and did a detailed review, and following that, I'm happy to say that he had very positive comments when he was here, but it takes some time to receive the final review, both from him, and then it's reviewed by a second forensic pathologist. And just the other day, we received our final letter indicating that we did pass and received full accreditation by the National Association of Medical Examiners for another 5 years, keeping in mind that we'll continue to do the yearly reviews. So that was good news, something we expected, but nice to get the final paperwork. And we'll receive our plaque that will replace the one that we have in the office now in the near future. All of you should have received our 2018 annual report. That's certainly there for you to peruse at your leisure, but there are some highlights that I can go over. And some of the highlights really are indicated in that front letter. But what really is important here is that, the office investigated more deaths in 2018 than we have in any previous year. So as expected, the number of death investigation does continue to increase. We did unfortunately hit an all-time high for drug-related deaths in 2018. I don't know at this point whether that is going to happen again for 2019. I'm actually hopeful that number may actually decrease a little, but I can't report that quite yet. Interestingly, though, our heroin-related deaths in 2018 decreased. So those are deaths which are related to heroin or have heroin on board as part of the cause of death for those situations. Our fentanyl-related deaths also decreased, so that was good news, but that was a very slight decrease of less than 1%, but it did decrease. But what increased and what caused our drug numbers to be at an all-time high were significant increases in cocaine, and cocaine really had not been a major factor. While it always has been present, it has never really been a major factor in the more recent times, and certainly last year that changed. And unfortunately, I think just sort of the gestalt of what's going on in 2019 is that we're having that problem continue. And what might have occurred years ago with fentanyl being mixed with the heroin population, I think now is occurring with the cocaine population. So we're having increases in the deaths related to cocaine, but also cocaine and fentanyl together. Also, our non-opiate related deaths increase. So our deaths related to methamphetamine, deaths related to prescription medications that are not opiates increased. So overall, it did take us to an all-time high, but I'm guessing and hopeful that maybe that will decrease a little bit in 2019, but we're not quite at that point to report. One other thing that I think is a bit concerning is the number of suicides seems to increase. In 2017, I believe there were 120, which is a sizable number for this county, and then in 2018, we had 136. So, and again, just the feeling of the work that we do every day, that number is still going to be considerable going through the end of the year. So I think we're at about 109 or 10 as of today, and certainly we have a couple more months left. So I'm guessing that we're going to be maybe at an all-time high for that category, which is unfortunate. So I certainly would be willing to take any questions that you have about the budget or our accreditation or the annual report or anything else that you'd like to discuss about the medical examiner's office.
Okay, Commissioner Brown.
Thank you. County, hello, Doctor, by the way, thank you for your service. You've got a lot of work over there. the county our size, the National Association of Accreditation, you said something about we have to have so many cases that go through your office to keep that accreditation. What's that number?
Well, they break it down by the number of autopsies per forensic pathologist for the office they're working in. There are Phase 1 and Phase 2 deficiencies, and the number is 250 to have no deficiency whatsoever. To have a Phase 1 deficiency, it's up to 325. So over the last 5 years, we've always been above the 250, but below the 325. So we've been able to maintain our accreditation, but we're doing it with a Phase 1 deficiency. Keeping in mind that you're allowed to have up to 15 Phase 1 deficiencies.
Can you define what a Phase 1 is?
Sure. The National Association of Medical Examiners has gone through, and there's a list of about 308 items that make up the whole accreditation checklist. They consider certain things to be Phase 2, which you cannot have any, and a Phase 2 is something that is of such significance that the board does not allow you to have any of those type deficiencies. And there was a lot of discussion as to what constitutes something that would be a Phase 1 or a Phase 2, but in general, if it's a minor deficiency, it's considered a Phase 1. If it's a major deficiency, it's a Phase 2. So the board defines accreditation as you can have up to 15 Phase 1 and 0 Phase 2. We ended up having 2 Phase 1 deficiencies, one of which we've had all along, and the other one was that we were just over, in our turnaround time, we were just over the level to have no deficiency at all. And that largely stems from the fact is that when you use outside pathologists who come in from other jurisdictions, and we have a lady who is a Michigan licensed physician from Ohio who comes here and helps us with cases, and we have other pathologists from Michigan who come and do cases. It's very difficult to directly manage their turnaround time, because here they're coming in to do work in the office and then they're going back to their facility, and it's just a difficult management process to make sure that they are turning in their reports as timely as possible. And while myself and Dr. Petrangelo do our best to get the turnaround time within that range, it's difficult for the outside people to do that. And the more cases they are doing, the more it puts us at risk for not meeting that 0 phase turnaround time. So we did have 2 Phase 1 deficiencies, again, very minor in the scheme of these things, keeping in mind that there's only 5 accredited offices in the state, one of which now is the Macomb Medical Examiner's Office. So I think even with 2 minor deficiencies, it certainly was a successful site visit and overall process.
And 14 is the number you want to watch, so we're nowhere close. So we're very good in terms of where we need to be in terms of accreditation. We're nowhere close to losing our accreditation.
I don't think so, as long as we keep in mind that you don't want to get anywhere close to something that would put you at a Phase 2, and that would be having to do more than 325 cases in the course of a year. That would limit your accreditation ability. But we recognized that years ago and put things in place to address it, and I think we're continuing to do that.
You really can't control that number, can you?
Well, we can't control the number, but we can control how we deal with the number of cases. Short of some type of disaster, I wouldn't expect the numbers to jump up dramatically in 1 year. These things sort of trend up rather than jump up considerably in 1 year. And of course, the board recognizes if you had something that was very unusual, they recognize that if this is not a continual trend, that it was a one-time thing, they do generate some leeway in those situations.
Now, I heard read somewhere that talk about you needed a bigger morgue. Is that true?
Well, to some extent, yes. We, in some areas of the building, we are very tight in terms of our space. And those areas include our storage ability with the number of files that we are able to store and just our general storage room. We have more and more investigators that have been hired over the years, and now most of our investigators are doubling up in terms of cubicle space. When our forensic pathologist comes in to do some work, they really don't have anywhere to do their work. We have to kind of put them in a makeshift sort of desk area. And so that was hopeful to be addressed, because going forward, I think this locum tenens position would ultimately be a forensic pathologist who is on staff at the Macomb Medical Examiner's Office. That's certainly something to look for in the future. Our cooler space is often a problem. While we haven't had to go to drastic measures of bringing in outside coolers and that kind of thing, but it's not an unusual event when our cooler is close to capacity. And so the new plans that we put together will address that. And then the other thing, one of the major factors that we're addressing with this new renovation is the security of the office. The new plan would recognize the fact that there does need to be secure areas. There does need to be a secure drop-off and pickup. Some of those things were addressed in the letter that we received from Dr. Nishalski. And one of the things that he mentioned is that while the office technically passes the accreditation item of having a secure area for drop-off and pickup of decedents that is not visible to the public view, he recognized that you kind of have a secure area, but not every site visitor might look at it the same way. In other words, there is the ability for the public to see that process. And so one of the things that we're doing with the new renovation is enclosing that back area, making it a garage area that would completely limit the public view into that area of the building. So the number of people in the office, the security of the office, and the cooler space are all things that are being addressed. The only thing that's really not being changed, because I think it's certainly adequate and it was built for the future, is the autopsy area. That would be left as it is.
And what's the cooler capacity and how much spaces?
It's depending on exactly how you do it, it's around 20.
20, okay. Now, several years ago, the board approved a expansion over there and work in your facility. Did any of that address any of these concerns, or is just the growth in your office created more need for modifications?
And because we have so many speakers, the answers can be brief, as long as you're.
Sure.
I guess I'm.
The renovation plans that have been put together were specifically put in place to address those three areas.
Yes. And have there been no work's been done on those plans as of yet, right? Those are just conceptual plans at this moment?
They're conceptual plans, and I think there's some plans to move forward with them in the next, maybe not the next calendar year, but the following.
Okay, it's in the capital budget. I didn't notice that. Is it?
2021.
Wow. We'll see how that goes. Good luck. Thank you.
Thank you. Any other questions?
Thank you. Yeah, there are quite a few. Commissioner Myjack?
Yeah, that was my question, was the capital projects budget, the $2 million. That's for security in the garage. What else are we talking about? A few other things?
The garage space, some fencing around the building.
Okay.
And expanding our investigative area so that our investigators have a designated workspace.
Okay. Because we have big budget deficits coming up, not necessarily for this year, but 2021 and 2022, so we have to look at everything. So, thank you, Chairman.
Thank you, Commissioner Duje.
Thank you, Madam Chair. Welcome, Dr. Spitz. I always look forward to your reports because basically I judged a lot of the mental health of the county by what you're reporting. Do we have a problem with overdose deaths on seniors on, let's say, 70 and up? Does that number stand out to you, or is that an anomaly?
I don't think the number stands out. Clearly, it always amazes me that we have heroin users and prescription drug abusers who are in their 60s and 70s. But I don't think it's a number that really stands out.
Well, a couple of years ago, there was some 72-year-old person in a nursing home that OD'd, and this was in Rochester Hills, if I'm not mistaken. And I till this day, I still don't understand how that could happen. But what was explained to me was that it was probably a family member that helped this person off himself, if you will. I find it just outrageous. On page 22 of your report, you have number of suicides. And I'm actually shocked that the biggest number is 50 to 59, and then next is 40 to 49. Is that national? Does that compare with national statistics, or are we
I think
off a
so.
little in Macomb, or?
No, I think so. 30 to 55 are probably is the biggest range for suicides. The younger people get the attention. When we have a teenager committing suicide, that certainly gets a lot of attention.
Yeah.
But the reality is that the bulk of the suicides are in the 30 to 55 range, with some being, and then there's a spike in the elderly.
Is this based on their health or problems with their health, or is it just?
No, I don't think it's based on problems with the health. I think it's based on other problems. I think mental health. When you say health, it's not physical health. In the older group, 70 plus, many times it is related to physical health.
Right.
In the younger people, it's not necessarily physical health. I think it's more mental health. And it's the environment that people are in, and it's the problems that they're having at home and with finances and with their job and those types of stresses that generally put the things in place. that generate
Commissioner, may I
people doing
just
that.
very quickly, what I'd like to do is, actually, maybe during government ops, I would love to have him back to talk about the details of the report.
That's fine, that was my last question.
Okay, thank you.
Thank you, Madam.
Because I do want to get back to the budget, thank you.
That's fine and dandy.
Okay.
Thank you, Dr. Spitz.
Thank you.
Okay, so my question is for Steve instead of Dr. Spitz. Hi.
Hello.
So in years past, we've had a breakdown of the medical examiner's budget, and it's rolled into the health department this year, I believe. And also, I think this senior services one is rolled into community action. I don't think we have a separate sheet on that. Have we gotten that in years past?
Senior services was rolled into community action 2 or 3 years ago, somewhere in that neighborhood.
Okay, and the medical examiners?
It's been in the health department budget as long as I can remember.
But I thought we had a sheet that broke down the expenses in his office.
Not in the budget itself, might have been some sort of supplemental schedule that I don't recall our office putting it together. Not that
Okay.
it can't, but.
All right, no, I guess the reason I think that we had that is back when we had to discuss the need for new employees, especially, before the other doctor was brought on, he was just absolutely inundated, and we might have had a breakdown at that time.
It's possible.
Okay. All right, Commissioner Romano.
Thank you, Chair. Hi, Dr. Spitz. Dr. Spitz, when you mentioned the fact of the cooler that your capacity, you might be sometimes at capacity, have you ever looked at co-oping with either Oakland or Wayne County, using their facility, or you guys sharing facilities? Do you understand? Did that make any sense to you? I mean, in lieu of us enlarging your facility, and I realize with the population growing here in Macomb County, you're going to get busier. It's going to be natural. And I also relate that to the fact of you're showing the suicide deaths and the opioid deaths and all the cocaine deaths. Again, the population is increasing. When that increases, it has to do with the economy also. Good economy, they can buy the money. When they can't, in fact, in a bad economy, I think it gets worse.
Sure.
Okay, so I thought maybe, again, looking at your budget and stuff, and I see that, I'm sympathetic with you on that regards, but I've also like to think that perhaps there's other communities that we could share services with that maybe save some money on your end also. Just a statement. Thank you, Chair.
Thank you, Commissioner Carabelli.
Thank you, Madam Chair. I guess this one's more for Steve.
Yep.
Steve, I know we charge fees and there's revenues for stuff that's done, from the cremation permits to the signing of the death certificate, removals, all different things. I don't see, where's that broken out in here as far as the revenue side of that? Where is that lumped in?
I would suspect most of that's gonna be in charges for services. I don't know. Patrick, most of that, there's gonna be some licenses and permits probably,
But
but
it's all
mostly
lumped together,
charges.
and I don't know what it is. Can we get that broken out? The reason why I'm asking this, just like any other
Broke
department.
out in what detail?
Well, of X amount of permits, what permits we're charging for, and what the return is going back into the general fund. Because just like, charging for documents here, it's about making a business case. Is it covering costs? Is it, when's the last time any of those fees have been looked at? And is there state regulation on what you can charge? I don't know the answers to any of this, but instead of keep draining on the general fund, I'd like to see, here's what the state says you can charge, or there is no limit, but our business case says it's X. For a personnel clerk to do X amount of filings, or whatever the number is.
I think Bill has an answer to one of the things you said.
Okay.
In the health department, we have a discretionary fee schedule that we create every year, and we review that every year. We've actually added some fees in the medical examiner's office because we were not charging for certain things. We just, body bags that funeral homes utilize. And we do review these fees with our program. So there are increases. There are always increases based on the consumer price index every year. And we do look at these every year and during the time of our budget. So we are, again, making sure that we cannot charge more than the cost of the service.
Not looking to do that, I just want to actually not subsidize the cost of the
So
service.
we are looking at those fees on an annual basis, and again, we apply those to our businesses, whether it's the food program or well program, so we do look at those on an annual basis.
Thank you. Thank you, Madam Chair.
Thank you. Seeing no other speakers, we do have a receive and file on the Health Department, correct? Please vote.
Thank you all very much.
Thank you. Motion passes 8-0. Now, Macomb Community Action, and I see Mr. Cutler is coming up, and if we want to have Director Sheila Coate is welcome to join him.
Thank you.
Good afternoon.
So, if you go to page 16 in our budget, in your budget book, you'll see that the county general fund allocation to Macomb Community Action this year is $4,054,200. And if I jump ahead to page B19, you'll see that in the budget book, you have listed three major funds, being general fund, road commission, and community mental health. And then of the non-major funds, Macomb Community Action would be the fourth largest fund. We make up over 25% of those non-major funds. Going on to, we have two types of funds. We have a calendar year set of funds, and we have fiscal year funds, and they're in two different sections in your book. In D3, you'll see our calendar year funds. That's Fund 344. And within that area, there's only one major change to show you, is that there was an increase in revenues. Utica is in the process of selling a senior housing facility that we had some community development block grant money put into. So when they sell that, we'll be getting back the money that we put into it. So it's going to be roughly $250,000, which is really the significant change in the budget. The staffing at Macomb Community Action, we have currently 295 bodies, which is, with the part-time employees, a large number of it is in full-time equivalents. It's 220.
We just had medical exam.
We did. So that is 225 full-time equivalents between our two funded programs. The big change in our budget this year was due to the class and comp study. So you see that our salary, fringe benefits, et cetera. The expense item under personnel was the increase. Again, the class and comp found that a lot of Macomb Community Action staff were vastly underpaid. So that is why we had such a large increase on that side of the budget. Of the money the county gives to Macomb Community Action, just over $4 million. That supports a total of $43 million between our calendar year and our fiscal year programs. And of that $4 million, over half of it is the indirect cost that Steve was discussing with you guys on Monday. So, well, you guys give us $4 million, we give over $2 million back to you to pay for your offices and all the other programs. So, to answer one of the questions that it was asked earlier was about AAA 1B. They give between $2.5 and $3 million to Macomb Community Action in a number of grants, the largest which is our nutrition programs. That would be Meals on Wheels and our congregate dining. That receives about 2.3 of that money. So those are the large funding from AAA. So we are working with the Finance Department, the Office of County Executive to address cuts that we need to make due to the increase in the class and comp without any increase from the county in funding. And again, I'm happy to go into any detail and any questions that anyone has. Thank you.
Okay, my questions are for Steve. I don't know why you're not just sitting on the outside. So on the other financing sources, he indicated we spend $1 million in general fund, and I see that that's going up relatively little compared to the size, the change in size on salary increases. How, and then I look down to the bottom, and then there's a net decrease in fund balance, which I'm assuming is, are you counting that different than general fund, the fund balance?
No, it's fund balance in their fund.
In their fund,
So
okay, so the fund balance at the end of the year, what's going on there?
At the end of 20?
Well,
Or going
no, but I
forward
mean,
when
we went
it's-
from, well, we could say, okay, let's look at the end of 20. We went from 715 down to 73,000. That's pretty significant. Then, in the next 2 years, really bad stuff happens. So what's going on there?
So that has to do, what we had originally requested was the use of $195,467,000 in use of fund balance. And we had asked that the county pick up half the cost of the increase for class and comp. As the county looked at their budget and didn't give us our requested funds, actually, there was a reduction because the amended budget numbers you have before you were, a couple meetings ago, I came before you and asked for an increase for indirect cost plan that we're getting charged this year. So the county is giving us $100,000 less in 2020 than they gave us in 2019. They also did not give us any increase for class and comp that was built into our budget. That's why.
Okay, with regard to class and comp, was it whose decision to implement the size of the pay raises then? Because, you know, I get confused on, some of the departments have a little bit of autonomy, others, with respect to his department, did we raise the pay of the individuals and then say we're not going to put money in the budget to do it?
Well,
Or did
understand
he
that.
look at the class and comp study
Yeah.
and make a decision to give those raises?
Well, I understand that a number of those raises are in the Head Start program and other programs that the general fund hasn't necessarily funded over time. So, again, sort of along the lines of if you've got a grant-funded position and grant funding goes away, the positions go away, kind of the same thought process. if you have Head Start where the general fund basically doesn't contribute much at all, if anything, if you have cost increases on the personnel side, we're not going to fund them, essentially. So then you have to cut program.
Correct.
You
So
gotta
my
cut program
question
somewhere else.
was with regard to the cost increases, because we did a comp study, but that comp study didn't put any requirements on us. It put pressure on us, but it didn't put any concrete requirements on us, correct?
Correct.
Okay. So within this department, who made the decision as to how to implement or what raises to implement because of the comp study? Was that his decision or was that our decision?
Those positions that we're talking about in this budget here were unionized positions, and unions such as ASME, UAW, that represent our employees also at MCA are also represented throughout the county. So this was.
It was negotiated by the county then?
By the county.
Director.
It was negotiated by the county.
So we negotiated pay raises and then said we weren't going to fund them. I want to make sure I'm clear that that's what's happened.
Yeah, because you have programs that are not being funded by the general fund historically.
Yes.
Right.
Yes, but we negotiated the pay for the employees. So we've created a problem that there doesn't seem to be a fix to. Would you agree with that?
No. I mean,
Okay.
there's a.
If you
there's
have a fix, I'm excited.
The fix is you have to examine programming and staffing levels.
Okay.
So programming service levels, I guess I'll refer to it that way.
Because this is a yearly difference in almost $700,000. So you see what's going to happen after 2022. This isn't sustainable. It just simply isn't sustainable. So, and, all right, I don't know what to do with that, but that's all I have. Does anybody else have any questions on this? I don't have anybody else. Okay, and did I do a receive and file? I did not. Moved by Romano, supported by Carabelli. Please vote. Oh, no. Hello, Mr. Scott.
Hello, is this on? Yes. We're good? Okay. Good afternoon, Commissioners. Thank you for your time this afternoon. For those who don't know me, I'm Edward Scott. I'm the District Director for MSU Extension here in Macomb County. We just want to thank you for your continued support. Because of that, we are looking at 102 years of this partnership between Michigan State University and Macomb County. And the support of the county has allowed us to serve 34,706 residents last year through a combination of services that included programs related to youth development, water quality and natural resources management, financial literacy and foreclosure counseling, and a whole host of others. We are in support of the executive's recommended budget. For us, it represents approximately 3.8 to 4% increase over last year. And that is due to some increases in personnel cost because of the class and compensation study, as well as a 3% increase in the memorandum of agreement, the budget administration agreement for the dollars that come directly to MSU. And I'm open to questions.
Does anybody have any questions? Commissioner Drollet.
Just a hypothetical question. If you had to find something in your budget to cut, if you had to cut it 10%, 15%, would you cut it across the board within those programs in the budget, or would you try to identify a particular program that would have to bear the majority of that?
Most likely, we would try and identify a particular program or a particular set of programs that would bear the brunt of that. We would take a look at community priorities, numbers, who's serving the most people.
Okay. I think that's the only question I have, Madam Chair. Thank you.
Thank you, Commissioner Romano.
Very quickly. Hi, Ed. Ed, I'm looking at your expenditures, and I look at your revenue. Your expenditures are $1.3 million, your revenues are zip. You ever look at trying to get some money in there? I mean, collecting some, you give a lot of services, but you charge for anything. You don't charge for anything.
We do, actually. Our finances are handled in-house at MSU, and so it's not reflected on these sheets, but we collect quite a bit of revenue for our programming.
And where does that revenue go?
Well, it goes to fund positions, program supplies.
Does it ever come back
things
to
of
us,
that nature.
to our general fund, after we give you the $1.3 million? I'm just asking, I don't.
Yeah, no, sir.
It doesn't come back at all? Wait a minute, here
No.
comes JP, Jack in the Box came up, go ahead.
It does reduce the contract costs that we have with
Yeah.
MSU year over year. So as they bring in more money from the mothership, that means more programs and service deployment here.
So, don't leave. So,
Not leaving.
again, I'm looking at revenue and it's showing zero here. Why is it showing zero?
Because it's not our revenue, it's their revenue.
Well, that's what I'm saying, so if it's their revenue, how come we don't get a piece of it?
It's
Well, the-
Michigan State's money. They
The
provide-
piece of it that you get is in the services that we bring to the county, the grant dollars that we receive to provide those services. It's an investment,
That's what it is, it's an investment.
yes.
We went through this last year, Mr. Drolet or Drolette. Okay,
Yeah.
thanks, Ed, I
Yeah.
appreciate, thank you, JP, appreciate it. I got it.
Commissioner Carabelli.
Thank you, Madam Chair. Just a quick question on contract services. Pardon?
Oh, you weren't up there, so I was explaining to him. Go ahead.
Oh, the big jump, if you didn't answer that?
I don't see the big jump in contract services. There's no, I don't have a jump here.
Well, from 18 to 19, and from 9,592 to 22,000. And before that, it was 10,000 down to $400, down to nothing.
I would have to find that answer for you. That occurred before my time.
Looks like somebody.
The
I
main
know.
jump is because we started funding the AmeriCorps position that's
Okay.
supplementing the Great Lakes Education.
Okay, so I apologize for that.
No
The jump appears to have come from the fact that we've been supporting an AmeriCorps position since 2018. So that added an additional $10,000 to bring us to the 22,000 that you see there.
I don't understand what that is.
So AmeriCorps is you could think of it as a domestic Peace Corps. It's a person who comes and offers to work for a very, very limited wage with a nonprofit organization or with a university, usually working on programs or projects that increase capacity and increase quality of life for the community.
Commissioner Duje.
Just like Commissioner Drolet. That too. Internal services, 38,006 and amended was 314. And then 20 is 315. You want to
Steve?
explain
It's the
why you
addition of the
went
indirect
bananas
cost.
that way?
It's the indirect cost allocation that we started in 19.
Are we going to have all this going forward on everybody?
Yes. Absolutely.
Oh, joy. All right. And if you can, have somebody give you $50 to get a reimbursement or something in revenue, then everybody will feel better.
Yes, sir.
Thank you, Madam Chair.
Thank you. Well, he explained the change in contract services. I was just going to hit JP with that because he said the revenues allow us to lower our contract services. And then I looked at the contract services line. It's going up, it's going up. But they explained that. Thank you. I do not see any other speakers. Do I have a motion? I do. Please vote. That motion passes 8-0. Thank you.
Thank you all very much for your time
Okay,
today.
new business. The first order in new business is to determine what Commissioner Drolet's name is. Now, he told me personally that his name was Drolet, and he goes by Drolet. And then when Romano corrected me, then he said in front of him, it's Drolet. So I think what we're going to do is either get clarification or make a motion as to what we're going to
I
call
motion
him.
to table.
So what do you? That was pretty good. What do you call yourself, really?
Leon. You can call me Drolette.
Drolette. Thank you. So I won't be corrected again. We have solved that issue, and we didn't have to make a motion. Okay. So with that, public participation.
I gotta just have to ask Sheila, how you enjoying the job, Sheila?
I knew you were going to ask me that, Marv. Well, it's 9 days today, so I've been very busy. 9 days, yes.
Okay.
So I made it 9 days. It's going very well, and I'm learning a lot, so more to come. Yeah.
Just
for
as
my
long as you
department.
put JP on the side, you'll do real well.
Yeah, I have to
Okay.
take public speaking lessons from him, because he is like so quick on his feet, and he's really good.
All you have to do is, add the
Good
word
luck.
leverage to your category and you're set. So I did fail to ask if anybody else had anything. Does anyone else have anything? All right, thank you for that, Marv. Seeing none, we'll close new business public participation. Does anyone wish to be heard? Seeing none, we'll close public participation. Move to adjourn by Romano, supported by Kraft. Please vote.
She always does that.
And we're adjourned. Thank you.